Hello, welcome to another time of health and wellness with Olajumoke. Have you heard about Hfmd? What is Hfmd? That is simply hand, foot, and mouth diseases. We'll be talking about Hfmd today, the causes, the symptoms, the treatment, and the prevention. So, what is hand, foot, and mouth diseases? Hand, foot, and mouth diseases are contagious viral illnesses, which is most common in children under the age of 5. Can also happen in older children and even adults. What causes Hfmd? Hfmd, just like I said, is a viral infection, meaning it's caused by virus. The name of this specific virus is Enterovirus A16. Another virus also causes the same thing in the same Enterovirus family. We have the A17 and Hfmd. Those may not be details you are interested in, but just like they are caused by virus Enterovirus 71 and also by Hfmd. And when they causes, how do they present? That leads me to symptoms. So first symptoms you may notice in someone who may have Hfmd is fever, temperature above the regular range of 36 to 37.5 degrees Celsius. So if a temperature of above that is noted, that may be a symptom of Hfmd. Not just only that, people can also present with soreness in the mouth or painful blisters in their mouth, on the tongue. Even some may have it on the palm of their hand or the sole of their feet. These are some of the symptoms, or it could even appear like a red spot on the palm of the hand or the sole of the feet. But it is interesting and it is remarkable to note that these symptoms will often appear 3 to 7 days even after exposure. So how can we treat Hfmd? 1, because it's a viral infection, we only provide supportive care. So there is no vaccination that can prevent Hfmd. In terms of treatment, you want to get the over-the-counter pain relief like your acetaminophen, your Tylenol, or your ibuprofen to help with painful symptoms and to help manage your fever, using it as often as recommended, like 6 to 8 hours. Another thing you must note with treatment is because of the soreness of the mouth and painful blisters, children or even older adults may find it difficult to eat or drink, which may lead to dehydration. So you want to encourage fluid, you want to promote fluid taking, you want to encourage such person, if it is a child, to drink more, provide acceptable fluid to these children or even to the older adults. The third treatment I would recommend is to rest a lot. Because there is a virus in your body, it's going to weaken your immune system. So you need a lot of rest to be able to do your daily activity better. So make sure you're getting enough rest. Thankfully, the symptoms will resolve between 7 to 10 days. But how can we prevent Hfmd? Together, we can prevent Hfmd through personal hygiene. You have to be washing your hands regularly with soap and water, because you really can't tell when you are in contact with a contaminated surface. So you want to wash your hand as often as possible. You want to also encourage your children to wash their hands as often as possible. 2, you want to always keep your environment sanitized, clean. Disinfect your environments, disinfect your children's toys as often as possible, especially when they share it with other people. You want to also be sure your daycare where you keep your children have this disinfectant wipes, and they do that often. You want to remind them when you go. You want to have a talk about it when you meet with their teachers or when you meet with the authority in your kids' school. Then you want to avoid close contact with people who are infected. It's good to stay safe and stay clean. So you want to avoid close contact with people that may be infected. and you want to encourage your children to practice cough sneeze etiquette. What is cough sneeze etiquette? You have to cough into your elbow, or you cough with a tissue. You don't want to cough directly into your hands and then touch another surface and spread infections and diseases. So you yourself, you want to practice cough and sneeze etiquette, coughing into your elbow, coughing into a tissue, turning your face away. You want to teach your children to do this just to prevent the spread of diseases. I believe this is quite important. This is quite important, especially because our children just resume school. Infections like this spread very easily because they share their toys, come in contact with each other. But the good news is it resolves on its own within 7 to 10 days, and you want to ensure you are preventing it as much as possible. I want to also remind you that there is no vaccination for Hfmd, and therefore it is only supportive care that is needed. If you have any question about Hfmd, please reach out to me via email, via text, via chat. You can even put it in the comment section right there. Till we meet again on Health and Wellness with Olajumoke, I want to encourage you to continue to stay safe and stay positive. Bye for now.